Hi, everybody. This is Jennifer from the Alumni Office. I'd like to introduce Dean Melissa Begg. Dean Begg became the 18th Dean of Columbia School of Social Work on September 1st, 2019. She is an accomplished scholar, committed educator, and creative administrative leader. Her work has focused on convening interdisciplinary teams, developing innovative curricula, creating mentorship programs, and enhancing diversity in graduate education and the research workforce. She is deeply committed to the school's social justice mission and the pursuit of better science for a better society through scholarship, education, practice, and collaboration. Please join me in welcoming Dean Begg.
Thanks so much, Jen, for your very kind introduction. And welcome, everyone. I'm really grateful to you for joining us today for a terrific conversation that I expect on holistic social work and the synergy between theory and practice with my wonderful colleague, Dr. Yamile Martí Haidar. Dr. Martí has been on faculty here at Columbia Social Work since 2011. And earlier this year, I was delighted to announce her promotion to Associate Professor of Professional Practice at the school. Dr. Martí is an innovative instructor, exceptional clinician, and active researcher on issues related to children and women in crisis. She has worked at the individual, community, and policy levels within mental health organizations, schools, support centers, and government agencies. Her clinical experience ranges from issues of substance abuse, the child welfare system, therapy and group work with families and children, with individuals with severe mental illness, with patients with cancer, and with women and children who have suffered abuse and neglect. Dr. Martí's research areas include the development of resilience and coping skills for children and women in crisis or facing adversity, as well as the implementation and evaluation of interventions that promote positive mental health in children and women. She also focuses on the role of psychosocial and cultural factors on mental health and the use of psychoeducation in myriad settings. Dr. Martí has served as a consultant for UNICEF and the UNDP, and has participated in several projects internationally in Jordan, Cuba, Brazil, Kenya, and Chile. We were thrilled with the news last week that the university has selected her for a Junior Faculty Diversity Award to work on an exciting new course she'll develop entitled Curriculum Development and Implementation, Preparation for Field Practice in Social Work, Professionalism, Self-Awareness, Ethics, and Power, Racism, Oppression, and Privilege. Having earned both her MSW and her doctoral degrees from the Columbia School of Social Work, we are so proud to call her one of our own alums, as well as a member of our faculty. Yamile, it's my great pleasure to welcome you to today's conversation. Thanks for being here.
Thank you, Dean Begg. Thank you for inviting me, and I hope we can have a fruitful and wonderful conversation and join the audience in the process as well. Thank you.
That'll be terrific, and I'm sure it will be. This is going to be a good conversation. So I'm going to begin at the beginning, Yamile, and ask you, where did your interest in social work come from originally? What inspired you to pursue this path?
So I was, for those that know me, I'm a proud born and raised Puerto Rican, and it started there with my family. I have a mother and father who instilled in my siblings and myself that service and working in our communities is part of sort of something that we have to do, not a choice, but a mandate. And I saw it by example through my parents, how they got involved in our own communities and work. And that's sort of how it all started. And I was one of those sort of unique characters that knew that they wanted to do social work since they went into college. So I never doubted my path. Yeah. And I was involved in volunteerism and community service work since a young age. I started a club called Helping Hands in my high school in Puerto Rico. Wow. And then when I went to college in the States, I was able to run the volunteerism program at my university. And from there, I came to Columbia. So,
oh, wonderful. Were you the first social worker in your family then?
Yeah, first social worker.
So you blazed that trail.
Yeah.
So that's terrific. Now, here's a big question for you. Careers evolve and transform over time. And I'm just thinking as you sit here today and with so much career ahead of you, but thinking back on where you've been and how you've gotten to this point, how would you describe your career and what motivates you to do what you do?
So I think the best description, and that's why I chose to sort of name this holistic, because it's really a group of components of things that inspire my work, from the direct work with clients and communities to be able to also think about structures, government policies, and how they interact and impact people. So I think if I look at it as a career that it's all in a basket. All of these elements are in my basket, and I pick and choose and have the luxury and privilege of being able to sort of select which one I'm going to concentrate more on, but they're all intertwined and interconnected. And I think the work itself is the inspiration. I think teaching and the work in the communities and the clinical work that I do, it's sort of what keeps me on my toes and maintains me interested in the field that way.
That's great. When you think about your training, which, as I proudly noted, was all at Columbia, you did your graduate training, you did your MSW and your PhD degrees here at Columbia School of Social Work. How does that impact how you function as a social worker in the education that you deliver and in the research that you perform?
So I think there's a saying that to whom much is given, much is expected. And I had the opportunity of having the privilege of studying at one of the best schools in the nation in social work with incredible mentors and professors, and also just being in the city of New York as my laboratory of learning and exposing myself to social work. And I think that really, I have a sense of not only pride, but responsibility to return that to the students that I work with every day and to the institution that formed me and to the city that sort of allowed me to have that exposure. So I think all of those things combined are part of what keeps me inspired. And Columbia, I think, has the ability to really allow you to go in deep. I remember my first semester as a social work student, I was placed at a methadone clinic, and I always had worked with children and families. So this was sort of like one of those placements where I was not exposed to anything that I was going to confront. And I was actually working with older adults. So it was a population completely new to me. And to this day, I always say to my students, it was my best school because I was forced to sort of be comfortable with the uncomfortable and the unknown. And that really allowed me to grow. And I keep saying that to my students all the time. The things that you don't know are the things that are going to shape your career and teach you what you're comfortable and not comfortable with, and grow from there.
I couldn't agree more. I think the things that are unexpected that occur during your career that I often greet with oh goodness, I have to do that now. What is that about? And they end up being opening doors to all sorts of things that you couldn't have possibly imagined without that experience. So I hear you on that. And I'm going to pursue that a little bit further. Were there other particular experiences or courses that inspired you while you were still pursuing your studies?
Definitely. So I did in my first year, I had that experience at the methadone clinic. My second year, I got the placement I wanted. I was working at CASA, Court Appointed Special Advocates, which is an incredible organization. But then I was working in the courts, and I had to work sort of in a system that I had a lot of conflict with, because the judges and the system would only take very few minutes to make decisions about the life of a child. So that was very impactful, because here I am in my population of interest, but the systems that I was working with were very challenging for me. And I created I realized how much I needed to do, not only in the micro work individually with the families, but also getting involved with more macro level work and advocacy and psychoeducation with that population. The other one was an opportunity I had as a doctoral student where I moved to Jordan. The school has very good relationships with Jordan, and we have as a university a global center there. And I was able to move there and work at the King Hussein Cancer Center. And that was my first exposure working with cancer patients. And again, a learning experience, being in a completely different culture, different system of work. And I helped develop their social work department at the school, at the hospital setting. So that was an incredible experience. And in terms of my colleagues and mentors, you know, I think professors at the school were all the time very supportive. I did a dissertation of collecting my own data, which is never an easy task, and they were very supportive of that.
Very
process.
brave, yeah. Yeah. And you're touching on this. You're touching on the advocacy, the policy, the micro work. Can you tell us a little bit more about what you mean by holistic social work and how that influences your mindset and your work?
So I think, you know, I had a conundrum deciding what I was going to do in terms of my doctoral program. And my way of solving that problem was going into a master's at Teachers College in psychology to decide if I wanted to be a psychologist or a social worker. And the reason I decided social work is because we truly look at the person and environment, not to say that my psychology colleagues don't, but it's really at the root of the profession. And I think if you're going to do good social work, you have to look at the person and its entirety. So where they live, what's their culture, where are they acculturating to if they are doing that, the systems that they have to live and work with, the communities that they live in, the macro systems of government and policy that relate to that. And so from the level of doing one-on-one work with clients or patients to the level of helping a government change, for example, their structure of welfare, you have to look at all of those components in a holistic way. How do they work together or don't work together? And so that's why I call it holistic practice. And it's also the idea that you cannot really do only theory, but that theory and practice go together. So whenever we write policy, we cannot really write policy without understanding who are we writing it for and what do they experience, live, and work with every day.
That's a great point. So, you know, in my background, I used to think a lot about translational research was the term that we used, but just sort of translating from one environment to the next context to the next context and understanding what individuals actually experience and having that inform policy and then getting their feedback on changes to policy is so critical. But they're like, they're points, they're very tenuous points, right? When you're trying to make that kind of translation, it's tough. And even when you talk to someone who talks mostly theory and someone who works mostly in the practice world, there's even differences in language and expectations and understandings. And how do you address that? You know, it's really, I think, a big communications challenge. And I'm wondering how you think about that. And because I'm guessing that a lot of our audience too tuned in tonight because they heard about the holistic social work, and it's exciting to think about that synergy between theory and practice. So how do you approach that very challenging problem?
I think language is incredibly important and a vital part of the work that we do. How we name things and the stigma or lack of stigma that those things have also matters. I think one of the ways that I do it is thinking about engaging all the parties involved. So community participatory research and practice, I think it's incredibly important. And we are moving, I think, more and more towards that. Not necessarily at the pace that I would like to, but I think it's where we're headed. And even in my research projects, or even if I'm working in a program where I'm developing sort of new policies for a system of government, hearing from the different entities that are part of that group, I think it's giving voice to all the voices that need to be heard. It's an important part of doing that and changing the landscape of, you know, us in an ivory tower, deciding for others when they have a voice and they have an incredible insight on what is actually feasible or not in their experience and in their communities.
Yeah, there's a real social justice element to what you just said too,
and even in micro practice, I work at the New York Psychiatric State Hospital, and we have a member who used to be a patient of the hospital in the inpatient unit who is now a collaborator with us in the groups that we do. And so she brings an experience that I or the students of social work cannot have or cannot understand, of having been there, lived there, stayed there, and understand the system that it is to be a patient in a psychiatric hospital. So I think that's another way of sort of changing the landscape a little bit.
Yeah. Those perspectives are invaluable, right? And it's not what you see around the table all the time. So that's bold and important, I think. I'm going to, this is a fascinating strain, but I'm going to segue a little bit now and ask you about the international work that you do, because that's been a big thread of your career, both in social work and in education, because you've done some really innovative things education-wise as well. So what spawned that interest in international work, and why do you pursue that?
So I think it starts when you reflect and you're born and raised in an island like Puerto Rico, which is part of the United States, but not treated as part of the United States in many ways, and still in a colonial sort of environment. I think it makes you think as myself as sort of international in some ways, because it's a very distinct culture, distinct language, distinct way of living. I also had the opportunity throughout my life to travel, and I saw it always sort of as a history lesson in my life. It taught me things that my systems of life did well, or others that I needed to learn from other places that I went through. And I traveled through school as well. When I was doing my bachelor's, I had a trip similar to the ones that I now have designed in the school that had an element of education to it. So I all of those things together and sort of curiosity of learning, I think I'm an eternal student, have led me to always be interested in the international realm. And also I think in social work practice, there is a need to learn from what other countries globally are doing. Social work is done everywhere in the globe. It's just not necessarily called officially social work, but there's community workers, paraprofessionals, and all types of social workers in the ground. So learning how they build programs, services, understand, for example, trauma or grief. I think it's an incredible opportunity pedagogically for us to learn, and also in terms of implementation science, of looking at how do we implement programs that are culturally attuned to the needs of the people that we're working with.
Yeah. Implementation science is a really interesting topic that I wanted to touch on too, because a couple of other conversations we've had, we've touched on implementation science with other faculty members. For our audience here, could you describe what do we mean by implementation science? What do you mean when you're applying that term?
So I think when we look at it, it's science that it's really not like the experimental component of a group that it's a placebo effect or not, and such a science-based, but more the science of actually doing the work. So we will implement programs, and through evaluation mechanisms in communities or in individuals that we're working with, we look at the work that we're doing both in the process of evaluation, so how did we do it, but also in the outcome of the evaluation. And so when we think about social work, it could be everything from a psychoeducation intervention that we are doing for essential workers, for example, that I have a group of colleagues and I are working with a project in Kenya and Brazil, and we're looking at how we can help them navigate the many difficulties of the COVID-19 pandemic. But they're part of the process. And so we're implementing an intervention, but they're helping us shape the process of how that implementation goes. And ideally, if we get the results of the evaluation, we can continue to do that work, but it's informed work in that, and it's scientific in its nature because we're measuring outcomes in that way.
Got it. Thank you for that. And you just alluded to, I think, a really novel thing that you introduced to the School of Social Work at Columbia, and that is the travel course. Could you please describe, just take a few minutes and talk about how you conceived of and put together these travel courses, which unfortunately are on hold right now, given what's going on in the world by necessity, but tell us about that and tell us what it's like for students.
So it started as just an idea that was floating around my mind when I was a doctoral student at the school. And I had the luck and the privilege that I was given the opportunity to do my own class as a doctoral student. And my first reiteration of it went to Cuba. So I had done some work in Cuba, traveled there. At that time, getting authorization to go to Cuba was only for educational purposes. So we were able and granted the authorization. Okay. And the idea is that, again, with theory and practice, that we will cover everything from history, culture, politics, religion, to also how social work developed and its practice in the particular country. And so I always tell my students that take this class, you're going to get a super intense history course and everything socially about the country and its context. And then I take them for the week of spring break there. And we visit everything from hospital, clinics, educational settings, our counterparts in universities that are social workers, research institutions. We also go and sort of visit communities and see the work of communities. In Cuba, for example, we visited a community that is self-sustainable. So they grow their own food. They sort of have their own clinic. So it's all self-sustainable within that area. And then over the years, we have done reiterations of it. And other of my colleagues have taken also the task of taking students abroad. We have done it to Chile and to Jordan. And in each of the countries, I think our students find a lot of similarities and a lot of uniqueness that comes from understanding truly where the culture comes from, the history of the country. So just to share an example, in Chile, there was a very deadly military dictatorship in the 70s and 80s. And to this day, the level of intergenerational trauma has been incredible in the country. And so every time citizens, even now with COVID-19, see the military mobilized, it creates a lot of triggers in them because that's what they lived for so long. And the 70s and 80s were not that long ago. Nice. And then secondly, for example, for our students that went, we had two, in one of the trips, we had two students who were former members of the military, and they were asking what services are they providing to the guards and military personnel that inflicted, violence and tortures, because we treat our military in the US. And there they said, we're not even ready to go there. We need to first treat the people who were tortured and disappeared family members. than treat the people who committed those acts. So it is a juxtaposition, but it needs to be understood within the historical and social context of each of the places we work at.
Yeah, so critical, right? Because that's a key determining factor, I think, in effectiveness and whatever program you're trying to deploy is understanding the context really, really well. And from that, you have to talk to the people on the ground, right? Yeah. So thinking about that in terms of developing programs or systems of social services, is that part of the course? Are students challenged to come up with that sort of thing? Or
so we have done different assignments throughout the years. This year, because of COVID, fortunately our students were not able to go to Chile, but we brought through this great technology. All of the speakers that they were able to meet there came to the class through Zoom, and part of what they did was sort of in a lens that it's not colonial, so not imposing sort of what we think are best practices based on the US model, but asking them questions about their experiences and what works about their programming or not, provide suggestions sort of as a platform of sharing ideas and as a think tank together with our counterparts in Chile of what would be some of the benefits of changing X or Y issue in a program or looking at other populations that might benefit from services that they're doing. Yeah. And I think it was very fruitful, and many of our counterparts in Chile were very grateful to just have a whole, new idea basket of what things they could do based on somebody who's looking from the outside about the work that they're doing daily.
Yeah, a new lens can really lend some fresh ideas. And in terms of your own work, how do you go about developing programs and systems in this way?
So I think in my work, it's I've been lucky enough to always have projects where I've been connected to people in the community, either through the work that I have done through United Nations or the projects that I have done with research, which are they're integral members of the process. So we do, in most of my projects, there's a collaborative board process where they come in as experts in their own field or in their own experience, and they share with the research team or the program development team what are some of the things that they think are needed, some of the challenges, some of the benefits of working with a particular community. And usually what we do is sort of develop the programming alongside with them and their input so that the final product is not our product, but everyone's product. And the same with sort of the training and practice. So I have done, for example, a lot of trainings internationally on developing new programming for the people who are going to enact those new programs. And again, it's a back and forth communication of what they, I have a great idea, but your great idea doesn't work for this particular population we're working with, because this is what we see in the ground. So whenever there's that exchange, I have found the work to not only be meaningful, but probably more successful in the result, because it's based on the reality of what people are living and experiencing.
Yeah, that requires a lot of, I would think, a lot of discussion, conversation, and really shared experience. So that's impressive. And I don't know how that relates to the work you've done with UNICEF and UNDP. So maybe you could tell us a little bit about those projects that you've undertaken and what those outcomes are like.
So those have been great experiences. It's another way of traveling with the focus of doing work. But UNICEF and UNDP, and to our audience, are great places for social workers. They need even more social workers than what people think. A lot of their programming relates to the populations that we work with, the idea of working with communities and empowering and helping and supporting communities. Yeah. So I have worked in places like Macedonia and Abkhazia, Georgia, and these are countries that have their own unique particular circumstances. For example, in Abkhazia, Georgia, they went through a civil war in the 1990s. Yeah. And there's a lot of issues of child welfare, neglect, and abuse. And so my team and I were asked to develop child welfare protection services for the community in Abkhazia. And then this is where it gets interesting. For example, we came with the lens of talking about trauma and how child abuse relates to trauma and the impact of trauma, and maybe looking at ways to treat it with trauma-informed care. And when we use the word trauma in our exchange, they said, no, this is not going to work. We don't say that word. That word has high levels of stigma. People are not going to relate to that. If you start and open the door with that, you're not going to have anybody in the door. So that is the exchange that we were talking about, that it's really fruitful. In Macedonia, for example, they asked me and my colleagues to develop a new social welfare system. Their employment services and their social work services work separately. and political leaders realized that they should work together. And so they were trying to do case management for both agencies where they work with one another. And we were able to implement that at a country level, which was really a challenge, but a really interesting project.
Yeah, sounds like it. Very challenging. I think, as you're well aware, we've been involved in the school for a multi-year conversation around power, racism, oppression, and privilege, because that's really one of the roots of social justice and racial justice, and how we can promote a more just society. So I'm just thinking about that. I know, we have a course on power, racism, oppression, and privilege as a foundational course now, and we're starting to, we've already well begun infusing that throughout second level courses, but we're also talking about the culture and trying to shift that. So just thinking about all of the work that you do, both in the classroom and outside of it, how does PROP inform this power, racism, oppression, privilege? How do those thoughts, that thinking, that mindset influence what you do in your work?
So I would say more than inform, it's ever present. It's not, I think by nature of who I am and how I identify, it's always gonna be there. I always tell my students the first day of class, not only that I'm Puerto Rican because of my pride, but I also have an accent and I speak fast naturally. And so I bring my persona into it, but I think it does inform our work, and it's at the center of what we do. We work with a diverse group of populations, not only through identities of race, but also of gender, the intersectionality of many of those identities. We work with systems who are not accustomed necessarily or know how to treat multiple identities and are working from structures of oppression that have been with us since the foundation of the US, for example, and in other countries is the same. So I think part of bringing it up is not shying away from having an open discussion about it. Bringing it up in, like, for example, in clinical courses, how our students are impacted by what a client might say or think about them and vice versa, and their biases that they might bring. And sometimes I feel because we try to be politically correct, we don't necessarily get into this really important conversations that require us to do self-reflection to change the ways that we conduct ourselves in the work that we do. And that, I think, is the key to change, to be able to openly dismantle all of these concepts and talk about them in a way that brings fruitful change. So that will be one way that I think it's very present in my work.
Yeah. Thank you for sharing that. It's really impactful. So you're a beloved instructor, I know that, a great educator. So I want to focus on that for a second and thinking about maybe some of our students who might have dialed in, or the ones who you interact with on a regular basis. How will you describe the benefits and challenges of the social work profession and your role in it, and how do you provide guidance to them? So thinking about it from your point of view and also thinking about the next generation.
So I think one of the things that I learned in my career being trained at Columbia, and I try to help my students navigate, is this idea of planting a seed. So the work that we do in many times could be frustrating, or you could get burnout because you don't see the results of the seeds that you plant. And that it's okay. It's not necessarily the most comfortable thing. I think a lot of people come into the profession with idealism of changing things and having concrete things that they can hold on to. But I do think that the beauty of the profession is just saying, I did my best to plant a seed and hopefully it will grow on its own, because you don't need to be present to see it evolve. And when I say that, I mean everything from having a client that you had a conversation with that you don't know how that conversation impacted them in their process of moving forward in life and regaining some control of whatever condition they might have, to working in a community and having you being an outsider, but giving them a different perspective or just attention that they haven't received before. And so I think it's a career of planting seeds, not necessarily always seeing the results of those. And I also think the other part that I hope that my students get is the importance of continuous learning. And I said that before, I'm an eternal student, but if you truly are a good social worker, you never stop learning or seeking tools to put in your toolbox. And that's a phrase that my students that might be in the audience would have heard 100 times. You know, you need to increase the tools in the toolbox and learn to pick and choose which tools are appropriate for the people that you're working with.
Yeah. So it's really a matter, in part, of taking the long view, right? Planting these seeds, expecting the far horizon is where you're going to see the flowers come forth. But That requires a lot of patience.
Yes.
Right?
And it doesn't come early in your career. I think it comes later on in your career.
Yeah. And I think I'll say too, it also requires hope, right? That you have to, you're planting the seed in the hopes of seeing that fruit or that flower someday, right? And even if you're not there to see it, that client will see it at some point in the future. So that's a beautiful way to put it. Thank you. I know that in part of your work, you focused a lot on psychoeducation. Could you describe, what that is and how you work on it and what drew you to that area in particular?
So my main mentor at Columbia when I was a doctoral student was Dr. Ellen Lukens, and she is an expert in the area of psychoeducation. And so that's how I started learning about it. But then I also was exposed to it through my work with agencies, and the agencies that I work with as a training doctoral student also use that methodology. And so psychoeducation is sort of the beautiful merging of education, but not from a hierarchical standpoint, but the exchange of knowledge and experience that comes from somebody who has a lived experience and then juxtaposes with somebody who might have the professional or clinical or expertise in that particular area. And so it's not, the idea of psychoeducation is to sort of deconstruct this. I'm the expert professional that comes to tell you what you should do, but you tell me what is your experience as a person, for example, that is suffering from trauma, or that a community that is suffering from racial disparities. And through that communication and interchange, we bear witness to the experience. And then that in itself is healing. So the idea of psychology comes from that bearing witness and exchanging that experience. And so those two components are major components of psychoeducation. It's usually done through a curriculum. So there's a structure and a flow to the process where you, with the feedback of the people that you're working with, deconstruct the curriculum that ideally goes from, what is the topic at hand that we're talking today, maybe going into specifics of how that manifests for the group or the individual, and then looking always and ending with coping mechanisms, going back to your comment about hope, trying to instill that whatever it is that we're talking today could have a potential idea of maybe moving forward, not necessarily a full solution, but a way of coping with it. And it's incredibly successful in the areas of trauma, of severe mental health. And I found it as a great tool, especially working in international settings and communities, because it allows for the voice of the people that you're working with to always be present.
That's fascinating. Can you think of any particular examples you could share with us about psychoeducation programs you've deployed and what that was like?
So as a doctoral student, I did my dissertation on the experience of foster care mothers. So everyone studies the children and everyone studies the parents who lose the children to the foster care system. Nobody studies these amazing people who take care of the children in between. And when we were, after I collected my data, we went back to the agencies to provide psychoeducation groups, because a lot of what we found is that these parents do it because they have emptiness syndrome, because they got divorced, because they wanted love and attention to give to somebody in their lives, and they didn't have that. And they did it for 15, 20 years, 7 years. So, and they don't get paid. There's a lot of stigma about they do it for the money. They get, in New York State, for example, they only get $500 for one child, and that has to cover every single expense. So we know that that's not enough money. Yeah. And 80% of children in the foster care system are children that have some type of mental health diagnosis. So it's a population that requires a lot of attention. Yeah. And the psychoeducation groups were the mothers, primarily there were mothers. We had 2 fathers that came to the groups to talk about their experience and ask the agency through sharing their experiences what things they needed. So for example, they're trained on safety precautions at home, but they were not trained on understanding the mental health issues that these children were having. Wow. So if a child didn't hug them or touch them, or they yelled when they touched them, and they were not purview to the fact that that child had a sexual abuse history, then they said, oh, this kid is very difficult. I don't know how to get through them. But with understanding, they would be better capable of managing. And so we did sort of that exchange where the agency heard that experience, and the agency also explained what they were capable or not to do, and developed a program where they were trained on the mental health needs of the children. And that really helped them maintain and retain the foster care parents, because the agency had a lot of problems retaining them because they were not supported enough. So that, I think it's a good example of how that dynamic of exchange and bearing witness works.
Makes a lot of sense in so many ways. So tell us a little bit more about your research, and then I'll turn to some audience questions. Our hour's going to be gone before you know it. But I know in the introduction, I had the pleasure of reading about all sorts of things you work on, women and children in crisis. You've just referred to your foster care work. Tell us a little bit about what you're most proud of in terms of the research that you conduct.
So I think going back to the holistic synergy, I think my research is always grounded on practice. So for example, I'm involved with a research project with colleagues from Virginia Commonwealth University on the mental health and health of older adults in Puerto Rico. Puerto Rico, as probably everyone knows, went through a severe Category 5 hurricane 2.5 years ago, which left the island without electricity for a year. More than 4,000 people died because of the hurricane. And so the mental health impact of that was humongous. And a couple of months after we just started to recuperate, we also got earthquakes, which are very rare and not common in Puerto Rico to have. And a lot of people lost their homes. And people were triggered to the point of listening to rain, and that would already trigger their emotional state because they would be remembering the devastation of the hurricane. Right. So one of the things we're doing is sort of assessing and looking at what are the mental health and health needs of this population, especially older adults. Puerto Rico, because of immigration to the US mainland of people that are younger generations, has become what we call an older country. And so majority of the population now, it's over the age of 60, which means that it's a population that we have to pay attention because it's the majority of people who are living in the island. And again, it's getting their experiences to help construct a potential intervention that could help them navigate those mental health and health problems. Another project that I'm very excited about is the one that I was mentioning in Kenya and Brazil, which is with a group of colleagues all from our school, who we are working in trying to do an intervention of psychoeducation for essential workers in the informal settlements of Kenya and in the informal settlements of Brazil. And interestingly, these are countries that are very different, and they're handling COVID very differently. Brazil is number 3 in the world in terms of COVID deaths and in the pandemic. Kenya doesn't have that level of numbers, but the impact on the communities has been incredibly horrific. So there's a lot of issues of policing, of grieving that, you know, in the cultures in Nairobi, in Kenya, grieving has to be communal. People celebrate the life of a person outside, they do ceremonies, and because of the pandemic, they cannot grieve the proper way that their culture deems necessary. So we're working with our collaborative boards in each of these countries to learn what do they need, what are the things that we should attend to in this intervention, and hopefully facilitate a space for them to be able to dialogue with us and share experiences so that we can support them.
Great. So that's work that's centered on COVID. And managing the epidemic. I was going to ask you if you had sort of ventured into that field, given everything that's going on around us and the long-term effects of what we're experiencing now. And you also mentioned the informal settlements. That's got to be a very challenging area in which to work, a very important area in which to work, but challenging. Can you talk a little bit more about the informal settlements?
So in Brazil, they're called favelas, and in Nairobi, they're informal settlements. I don't speak the language, so I'm not going to change the name. But they're communities that are usually suffering from structural oppression and racism, that are people that live together in very enclosed community homes with multiple members of the family and different generations of the family. And many of the community leaders and people who are doing the work in the communities are members of those favelas or informal settlements. So you have somebody like in Brazil, we have a young man who's a member of the favela, who is going to school, who is also a sort of a leader of the community that people come to, and he's one of our board members. We have also a doctor from one of the clinics within the informal settlement join us in the process. So it's difficult work, but I would say it's the most important one because the change is starting from within. They recognize a lot of the structural issues that they have to be going against, and they want to be vocal and advocates for their own communities, but also serve as example for other communities that need a voice and might not have found it yet. So it's really inspiring work that they are trying to sort of survive. And the most incredible part of those meetings is to see how they help one another. So we are almost like spectators listening to amazing stories and experiences that they're helping one another with. And that is really powerful in the process of our work with them.
Yeah. That is fascinating. And it just so happens I was having a chat with our colleague, Sam Winter, earlier today, talking about work in informal settlements. And she told me that there's a billion people around the world living in informal settlements. So again, critically important work, and giving voice to a group that is not often given voice to. So thank you for that. I think it's coming on time. We have an hour together, and there are questions popping in all over the place. So I'm going to start with one question that was submitted in advance. I'm going to bounce back and forth between the questions that folks are asking now. So everyone who's listening, please feel free to put questions in the Q&A box. There's some there that I will try to get to. I don't think we'll get to everything, but we're going to do our best. But I want to start with a question that someone submitted ahead of time, because I think it's really important. In practicing holistically, what does that mean in terms of how you care for yourself? Does a practitioner need to essentially practice on themselves in the same way? So how do you see that, Yamile?
That's a great question. I think being a holistic social worker to me is the way that I do sort of self-care, because I learn from different people, and I sort of balance my work through having different avenues to be able to enact the work that I would like to do. And so I think that self-care comes from being able to have a multiplicity of sources of information and support. I think there's components of it that are global for all of us. It's having the right colleagues and team members that you can rely on to sort of, after a long day of collaborative boards or an intervention, be able to sort of debrief and talk to. And I also think just taking care of your health and mental health as a clinician, knowing your boundaries. I always tell my students, for example, when I worked at the Cancer Center, I loved my work there, but I realized I really had a hard time dealing with death so frequently, and especially because I was working with children who were dying of cancer. And so I learned through my experiences what are my limitations, and I reflect on them. And it's not that I wouldn't do work with that population again, but I now have more self-awareness. So I think a lot of reflection is part of the self-care process.
Yeah. Thank you for sharing that. I think that's really important for everybody to think about very carefully. People are amazed at sort of the breadth of the work that you're engaged in. And someone mentions here you work in so many different clinical settings. So how do you develop expertise across those different settings? And how many years of clinical experience did you engage in after you finished your degree?
So I have now probably 10 plus years of clinical experience. I continue to do clinical work even through my work at Columbia. I devote my Fridays to working at the New York Psychiatric State Institute, and I help some of the agencies in foster care in the cities with their programming and groups. I think part of what has been important in my work is to sort of center in the areas that I know well and I'm interested in. So for example, working within resiliency, mental health, and psychoeducation are sort of my areas of expertise that I have been able to mold and change based on those other areas that I work with. And they allow me to do that because psychoeducation really can be tweaked to the particular population and setting that you're working with. So I think my expertise have been ones that can be intertwined in all of the hats that I try to wear every day.
Yeah, not easy, not easy. There's a lot of threading going on.
Yeah.
Someone had also asked, based on your experience working, so you work clinically, you work at the policy level as well, and a big theme of, I think, what you've described to us today is the interactions, the synergies between those two. So someone has asked us, could you provide any insights on how to foster that spirit of theory practice synergy for policy researchers and professionals whose career paths often look different from clinicians? And we were talking about translational work a little earlier. I think there's some translation going on here and some integration, which can be really one of the hardest parts of what we do. How do we get those, how do we foster those conversations and that thinking?
And I think for our policy colleagues, social work is such a central part of policy, because the way that we're trained is that we're training systems. And when you're creating policy, you have to think about multiple systems of work. I think one way that you can do that synergy is through the community participatory, what we call research or integration in policy. In clinical work, we also do it in programming. So really making sure that whatever policies and programs you're developing are centered around the voices and needs of the people that you're working for, and including them in that process. It's actually going to be more effective, cost effective, And in terms of outcomes, probably much better programming and policy if you know from the people that are living in those communities or living those policies what can work and what cannot work. So it's a beneficial method for everyone involved.
Yeah, thank you. Someone else had asked about interdisciplinary collaboration, right? And that can be tough because I think that's some of the hardest work that we can do in any arena. Because of the different sets of expectations and traditions and so forth. Do you have any tips on how to manage that or how to plant that seed and make sure it blossoms over time?
So I have always shared with my students, and I think it's because of my own experience, especially in clinical settings, but also, you know, within research, that we need to have a loud voice. And so as social workers, sometimes we're seen as bottom of the feeder of like the importance of maybe the medical physicians, the psychiatrists go before us, and then we are asked, oh, what do you think at the end? And I always say to my students, bring in your voice immediately. Like say, because you're probably the only person in the room that knows every single aspect about that family or that individual. And those other people in the room have very, very important roles, but they know probably one segment of what you know. And so I think interdisciplinary work for it to be successful requires us to be advocates for our own selves in those settings, and also to explain to our colleagues and the people that we work with, what is social work? What is it that we do? It's so diverse. It has so many different faces. And I think a lot of people just don't know what social work is and how it's practiced. And I think we have a mandate as professionals to sort of make that be known that we're in the room.
Yes, I think that's really important. Thank you. And I've had some conversations with deans of the other clinical schools at Columbia. So I'll talk to you more about that. But I think sort of injecting perhaps something into those curricula as well and having some curricular exchange between our schools so that everyone on the team knows what everybody else's role is and can be. And that's just for the good of the patients and the clients and the organizations that we serve. So thank you for that too. Someone mentions here this has been quite a year, right? So it started with COVID and then the disproportionate effect that COVID is taking, impact it has on communities of color in particular. And then we had the murder of George Floyd and the resulting protests and, you know, some encouragement in the fact that people are saying they're not going to tolerate this injustice anymore. So thinking about the anti-Black racism that we bear witness to, thinking about the anti-Asian discrimination that we also have borne witness to this year with COVID, someone has asked, how do we build resilience and coping skills in all of these affected populations? And, you know, this person refers to an anti-Asian script, but I'm going to extend that too to anti-Black racism. How do we build those coping skills? And I think social workers are sort of essential to that.
I think not shying away from the conversation and allowing room to bear witness to the suffering and the pain of all of our communities. Not necessarily assuming what they're experiencing, because that I think it's oppressive in itself, but asking what is their experience and what they're feeling. I think bringing awareness to those issues and to the uniqueness of each of those communities, I think it's important. Every community goes through some general themes that are similar, but they manifest very differently. I always bring that within the Latinx community just because it's such a huge community, but in each of those sub-communities that it covers, the experiences of immigration or language or acculturation are very unique. And so I think it's a matter of really bearing witness, awareness in the larger sense of the awareness word, and then advocacy. Looking for ways in which we can support the communities that we're in, looking in ways in which we can create dialogue so that we can build from that rather than sort of us versus them. We all are together in this process of change. And I think that it's very important. That's why I promote and believe so much in sort of doing community participatory research, because it's the way that we're giving, you know, voice to the voices that have been many times silenced throughout history. Yeah,
for sure. Thank you for that. Someone has asked here, they're asking about a book from 1926. I think this is one of your former students, actually. It's a book by Smuts, Holism and Evolution. Is this book the basis of your theory of holism? What would you say to that? No?
No, it's not, but I now will read it. I'll put it in my book reading list.
Okay.
Thank you for sharing that, Victor.
Sure. Yeah. Good. And another person asks, may I ask, what are the required skills and qualities for international work? So, and maybe bring that out a little further to say, if someone were contemplating following in your footsteps and trying to do international work, what do you think are the important things to bear in mind, and maybe some tips for how to do that successfully, and maybe pitfalls others could try to avoid based on what you've experienced?
So part of what I was saying at the beginning, I think it's important to reiterate, is that social work is probably one of the best professions to go into the international work arena, because when you learn and you're trained to work in systems and to really like zone in into what are the needs of each of those systems, then you are more capable than a person that is not trained that way to sort of look at the whole entire picture of the work that you're doing. And when I say that, I'll back it up with maybe examples, is that in each of the countries that I work in, social work looks very different and it's practiced very differently. It's in some, it's not regulated. In some, it's in charge of the people in their own communities. It's not something that it's academic or formal or has an NASSW component to it. And in others, it's incredibly advanced, and it's a career that it's sort of lifted rather than looked down upon, in the sense of how important it is. And there are social workers that are part of government and policy making at the highest levels. And so I think the skills and qualifications come through the training. To get social work international jobs, it depends on the places you go. So if you want to do programming, if you want to develop sort of particular programs or clinical settings, you might need to have credentials in the country that you're going to.
Right.
If you work as a consultant, you might be able to navigate then the skills that you have and then use them in the particular consultancy that you have. So it really depends on the environment that you're going to work in and your role in that environment. But I think we need social workers in international work at all levels: policy, SEA, community work, and also in the clinical arena. I think we have a lot to learn from how other systems of health and mental health work, and implement some of the things that we could learn from them in our own practice. Yeah.
I think, as I think about Columbia, which often calls itself a global university, and we have this network of global centers, which I think you've interacted with through some of your work. I think one of the big advantages to that is the ability, it's not just doing work regionally, but learning how something works in one region and then learning how to adapt it in another region. Is the comparative part of this important, or how important is it, or is it a hindrance? How do you think about that?
I think it's incredibly important. I think the lessons that you learn from one particular place and that translate or do not translate to the other help you. It in a way helps you have a non-oppressive practice, because if I go into international work with one model of work, I am being oppressive in that sense. And so I think part of what the compare and contrasting, it's lessons learned of what could be used that I didn't think about in the same context or similar context. For example, 2 informal settlements in different countries, one might be doing something really well that I could try to adapt to the reality of the other, but also considering that, I need to work with who these people are, what they need, where they are in that moment in time. So I think it is very helpful, but should not be a deciding factor, because you want to make sure that each of the places is looked at uniquely in that sense.
Yeah, really important. Thank you. In this era of COVID, where many of us are still in, trying to keep physical distance, trying to stay apart as much as possible, sad that is, I'm wondering, and someone has asked here, this is an example. Here we are, we're having a great session, we're doing it electronically, right? This is our world has changed. And someone asks, how does technology or telemedicine play a part in the future of our field? So you can tell us maybe how it's impacted your work, and maybe share any thoughts you have about long-term impacts in how we work in the field.
So I think it's here to stay, not only because of the pandemic, unfortunately, but also because many places have realized that it could be easier, more cost-effective for their institutions, because other clients that now don't have sort of many barriers to join. That you can just open your laptop or computer, but there's also the structural issues of not having people who don't have a computer, who don't have internet, who don't have access to a tablet or a computer to be able to join. So I think in the development of this new world of health and mental health services, we have to consider all of those factors. I think it's here to stay also because we are training individuals to sort of work in a way that they can do both, and maybe we will eventually go into sort of a hybrid model for it. One of the biggest challenges, and my students have been talking about it in class all of the semester because they're doing most of them telehealth, is the things that you miss in the room. You're only able to see a face. You might not see the verbal cues. You might not, see if your client is sort of fidgeting or gets nervous, or they cannot see your nervousness. And there's a benefit and not such good benefits from all of that, but it requires almost more attention to detail and to sort of being aware of the room than it does when you're in person, because you can capture those things more easily. And then the other issue is privacy and confidentiality. Many of our clients or patients are working in settings or living in settings where they have their families, their children, and obligations, and they're teaching their kids while they're trying to do their therapy, and it's impossible to do. And then you think of populations who don't even have access, like individuals who are homeless are not able to have, any of this structure. So I think we need to think about it again in a holistic way, where we serve everyone who's needed, but we also realize that to do that, the capability and the help and the supports that we need are not structurally there.
Yeah, we're hearing about that in a lot of different ways, right? Even children who don't have access to the internet and they're supposed to be in school from home, and it just can't happen. So we really have to think about that. And someone has asked, do you do any work with older women? So we're talking about women and children, so I think people are picturing mothers of a certain age, but thinking about women who are members of families who may be subjected to abuse and that sort of thing. Is that part of your portfolio as well?
So with the work that we're doing in Puerto Rico, it's entirely older adults. Primarily the interviews, interestingly, have been a lot of women who tend to be head of households. Even with the constructs of machismo, Latino culture has a lot of matriarch principles to it. So the woman is sort of the neck of the household that controls everything. And we have found, unfortunately, a lot of issues and instances of familial abuse, and also even abuse in institutions, which we have reported, and we're working closely with our colleagues in the ground to make sure that we have safeguards for the individuals affected by it. It is more pervasive, and it's unfortunately, I think, an area of social work that we always think of abuse immediately as children and issues of IPV, interpersonal violence, but we don't talk enough about elder abuse, which is a very large segment of society that is affected by it.
Wow, yeah, that's a really good point. And because we're running down on time, there's one more question I want to ask that was submitted that I'm really fascinated about. Someone asked, I'd like to know if the approach for treatment used to help children from war zones or helping refugees through trauma-informed care are the same that could be used for children who may have witnessed mass shootings at their schools in the United States, which, as you know, is just all too frequent.
Yeah,
are there lessons we can learn and carry from one context to the other in this arena?
So I think there's elements of trauma-informed care and interventions, for example, like trauma-informed CBT, that could be really helpful for children in this particular instances of horrific acts that they're witnessing, and especially acts of violence. So we can sort of bring out triggers that are related to the violence. For example, listening to the trigger of a gun or gunfire are sometimes some of the things that commonly children will come up with in terms of some of the images or triggers that they are recurrent. I think, I would say that those are sort of general themes that we want to look at, but each of those settings are very unique. Children in a school, which is supposed to be a safe haven, which is supposed to be a place that they're protected, versus children who unfortunately live every day in war zones. So this is their everyday bread and butter, and that's how they live their lives. So it's a very unique ecological system that we're talking about in each of these two populations that needs to be considered when doing any type of intervention or work.
Yeah, really good.
And also the children in the war zones probably have less ability to get services than a child that lives and goes through that in the mainland. So in the mainland US. So I think it's important to also consider access to and acknowledgement of trauma when it's recurring all the time, every day, versus a one-time episode that it's not recurring all the time.
Yeah. Thank you for highlighting those differences. Really, really critical. And I'm glad you and your colleagues are working in this area. It's really so necessary and so appreciated. So thank you.
Thank you.
we're at the end of our hour already, which I can't
That
believe.
went fast.
It did go fast. It did go fast. Thank you for making that happen. Is there anything you'd like to say in closing before I?
Just thank you for the opportunity to share a little bit about my work. It's a great way, I think, to also give back to the place that trained me and helped me become the social worker that I am. And I just want to wish everyone to be healthy and take care of themselves and their loved ones in such a difficult time as we're going through.
Yeah, for sure. Thank you. Yamile, I can't thank you enough. This was a really terrific session. I enjoyed it very much. I'm sure our audience has enjoyed it too. Thanks everyone for your questions. I'm very glad you joined us today. I am incredibly proud of the faculty here at Columbia School of Social Work, and it's truly a joy for me to engage our faculty in this way through these hour-long conversations so that our alums and friends can also get a firsthand look at the exciting work that they're doing in the classroom, in the clinic, and in our communities. So this is a great opportunity. We're very eager for your feedback on these sessions. So after today, after we conclude, you're going to receive an email request to fill out a very brief survey so that just like in the immortal words of our former mayor, Ed Koch, you can tell us how we're doing. You will also be invited to make suggestions for future sessions. So if you have any ideas, please share those with us. We're eager to know what you think. So in closing, again, thanks to Yamile, thanks to all of you, thanks to Jen and her office for setting this up. I wish everyone very happy holidays ahead and all the best as this year winds down. And I'm looking forward to the new year with great hope. Please, everybody, stay well. Thanks.